Welcome to the Vector 2 Hand CPM video brought to you by Thuasne. My name is Perry Mervar. I have been formally trained as an occupational therapist, and I am Vice President of Clinical Education regarding the Vector 2 Hand CPM. This short 19-minute video has been constructed to share the latest in Hand CPM technology. The benefit of watching this video is an expanded knowledge base regarding the management of hand range of motion. Clinical advantages offered by Hand CPM include edema reduction, pain management, tendon gliding, and prevention of adhesions. These clinical benefits are outlined on pages 567, 569, and 571 in the 5th edition of the Diagnosis and Treatment Manual for Physicians and Therapists, published by the world-renowned Indiana Hand to Shoulder Center. Customers we serve include the PT, OT, CHT, OTA, PTA, PA, MD, nurse practitioner, nurse case manager, the patient, and payer. When one of these customers identifies a candidate that would benefit from a rental Vector 2 Hand CPM, a Thuasne representative will run insurance benefits by acquiring patient demographics, MD and therapy notes, and a prescription. The patient is then contacted and device features, advantages, and benefits, as well as insurance coverage, are discussed with the candidate in order that a fully informed decision may be made by the patient. Contemporary rehabilitation challenges in today's market include limited visitation, double patient bookings, PTs and OTs performing evaluations with minimal patient contact thereafter, productivity demands, and patient noncompliance. Thuasne's adjunctive Vector 2 Hand CPM is designed to help overcome these challenges. The anatomical structures of the hand and wrist are complex. Bony and soft tissue structures that work in unison exist in tight compartments. Therefore, timely intervention is critical to restore maximum function. Waiting too long to incorporate treatment techniques that may include adjunctive devices is a mistake from a rehabilitation standpoint. As soon as passive range of motion is cleared to begin, the Vector 2 Hand CPM may be utilized to complement the recovery process. The 3 stages of soft tissue recovery begins with the acute inflammatory process, which occurs in the first 72 hours. In this stage, CPM is ideal because of the modality's influence on prevention of intra-articular adhesions and extra-articular contractures, reduction in postoperative pain, improved biological healing, maintenance of range of motion, and enhanced tendon gliding. The next stage is the fibroblastic stage, where CPM continues to be of benefit and splinting is ideally utilized due to the responsive characteristics of soft tissue remodeling. Timely intervention produces positive results regarding clinical sequelae. Both early and progressive results have a compounding effect on patient compliance regarding home exercise programs and adjunctive device use. A secondary benefit of timely intervention is cost containment, as the astute therapist's actions reduces overall rental periods. It is important to realize that education regarding device fit, pause times, and dosage will change during the healing process. Consultation between the physician, occupational therapist, and physical therapist should be an ongoing process addressing form, fit, and function of the ordered modalities. Patients may begin to develop low gadget tolerance as time advances, necessitating the transition to lower profile devices to maximize the clinical outcome. We will now discuss Thuasne's acute care product, the Vector 2 Hand CPM, in detail. The Vector 2 Hand CPM is the most advanced hand CPM in the domestic market. The predecessor to the Vector 2 was the Vector 1. The Vector 1 addressed the 3 main issues prevalent in all hand CPM machines to some degree. The 3 main issues can be encapsulated in the acronym FDR, which stands for force, donning and doffing, and range of motion. Force. The Vector 1's motor was designed to articulate the digits into a composite fist, even when the machine's motor competed with postoperative dressings. Donning and doffing. The Vector 1 included a unique proprietary glove system that facilitated easy application and removal of the device. The anchoring of the glove system did not contribute to edema in the hand, as wrist joint circumferential strapping was intentionally avoided by design. Range of motion. The Vector 1 went beyond anatomical norm to overcome soft tissue and mechanical give in order to achieve anatomical norm. These three features propelled the Vector 1 Hand CPM into most major hand centers, where the machine served as an adjunctive rehabilitation device for over 10 years. Fortunately, Thuasne's rehabilitation devices serve customers who provide continuous improvement feedback. As the Vector 1 served physicians, clinicians, and patients, voice of customer feedback was captured. As the Vector 1's componentry began to sunset, a new and improved Hand CPM was launched, demonstrating the design inputs gathered directly from the end users in the marketplace. The Vector 2 Hand CPM was launched on April the 4th of 2022. The design inputs will now be discussed in detail. The Vector 2 Hand CPM may be programmed to go beyond anatomical norm. This design feature is intentional, as range of motion products must overcome two challenges in order to achieve anatomical norm. The first challenge is soft tissue give, and the second is mechanical give of the device. Combined, these two challenges can rob the device of terminal range of motion. For example, historically, hand CPMs would max out at 280 degrees of flexion. When calculating 15 degrees of soft tissue give and 15 degrees of mechanical give, previous machines could not deliver a composite fist. To overcome the 30-degree lag, the Vector 2's hand controller is simply programmed to 310 degrees of flexion, accomplishing an anatomically composite fist. The same principles hold true as discussed on slide 7 when hyperextension is desired for palmar hand burns or maximum tendon glide. Malleable actuator springs are an additional design advantage of the Vector 2 Hand CPM. These adjustable springs increase and/or decrease the articulation of individualized digits when considering varying clinical presentations and pain tolerance. An improved volar plate with 4-point harness is also available, resulting in increased wrist support, comfort, and efficient stretch. Optimal exposure of the distal palmar crease is made possible by following correct order of operations when anchoring the straps. The benefits of Hand CPM can be summed up in the acronym PRIME. PRIME, P, prevention of intra-articular adhesions and extra-articular contractures. R, reduction in postoperative pain. I, improved biological healing. M, maintenance of range of motion. And E, enhanced tendon gliding. These benefits are complemented by engineering principles specific to the Vector 2 Hand CPM. Reflecting on historical data, the number one indication for Hand CPM use is post-op tenolysis. Fortunately, it is not a stretch to consider a Vector 2 for a patient undergoing a tenolysis procedure, as the physician, clinician, and patient already have physiological scar history. Hand CPM post-tenolysis is recommended by the authors of the Diagnosis and Treatment Manual for Physicians and Therapists, 5th edition, written by the Indiana Hand to Shoulder Center. The Vector 2 keeps the advantages of FDR with the additional advantages of adjustable posts, identified by the arrows, to accommodate varying digit lengths, resulting in improved joint articulation. A 4-point volar plate eliminating dorsal lift-off of the device as the digits are mobilized into flexion complements a more accurate display on the device's hand controller. 3 glove sizes facilitate therapeutic compression, assisting in edema reduction and desensitization. Specific to active tendon excursion, the well-received finger shoes will be discussed next. Finger shoes are detachable tabs that connect the finger plates to the unique glove system. The advantages are so numerous that all Vector 2 hand CPMs are equipped with finger shoes. Active tendon excursion without removing the device has complemented the hand therapist's home exercise program by incorporating a specified runtime upon setup. Donning and doffing of the device has become even easier, especially when treating a mangled hand injury. These types of injuries present with less than ideal range of motion for donning and doffing, as well as sensitivity issues. In both cases, the patient may don the glove outside of the machine, slowly thread their hand through the dorsal and volar hand plates, and then lower the finger plates to their finger shoes for ease of application. When cost concerns exist with challenging bilateral hand injuries, one machine may be used by arming the patient with a left and right glove equipped with finger shoes. Tendon gliding exercises are easily accomplished without the removal of the Vector 2 hand CPM due to the clip-in, clip-out ski boot nature of the finger shoes. As active tendon excursion is superior to passive motion, now the Vector 2 hand CPM candidate can benefit from the prime of the modality while also maximizing tendon excursion and incorporating relative motion splinting if desired clinically. Reflecting on historical data, the number 2 indication for hand CPM use is post-op capsulotomy. Capsulotomies are frequently performed in conjunction with tenolysis procedures, and hand CPM post-capsulotomy is also recommended by the authors of the Diagnosis and Treatment Manual for Physicians and Therapists, 5th edition, written by the Indiana Hand to Shoulder Center. The Vector 2 may be configured to specifically address MCP capsulotomies of digits 2 through 5, which are frequently contracted post-crush injuries. The finger shoes allow the finger plate to be quickly and easily positioned at P1, P2, or P3, depending on the clinical presentation of the hand. The ability to mobilize entire digits offers edema reduction advantages, while the ability to focus forces at specific joints complements digits that may only have a specific capsule that needs to be isolated. Injuries that are sustained from factory machines, saws, and explosions tend to result in partial digit amputations. In the past, residual digits were somewhat neglected with the majority of attention placed on the remaining intact fingers. Product innovations, such as the naked prosthetic device, have brought attention back to residual digit length. Rehabilitated proximal phalanx motion can produce tremendous functional results for patients who transition into this contemporary product. The Vector 2 has been instrumental regarding this transition for numerous patients, as was discussed earlier and visualized by the bell-shaped curve of the Phillips head screws on the finger posts. Residual digit length may now be accommodated like never before due to voice of customer feedback. In regard to tendon injuries, the wrist hinge may be positioned in flexion and extension, placing flexor and extensor tendons in protective slack during passive and active range of motion. This feature should allow earlier utilization of the product, enhancing outcomes. Pi-wrap forearm straps facilitate ease of donning and doffing for the unilaterally involved patient. Pi-wrap hook has high shear and low peel properties, making one-handed circumferential strap adjustments much easier. In regards to the hand controller, a smaller, lighter, full LED touchscreen display with intuitive navigation is understood even by patients who are technologically challenged. As it is required by some patients to travel to their physician and hand therapy appointments, the Vector 2 has 2 power source options. The device may be plugged into a wall outlet directly or be powered by a lithium iron phosphate battery pack. Device portability offers solutions to all rehabilitation stakeholders. Please take time to acquaint yourself with the advantages of the battery power source. Advantages of the lithium iron phosphate battery pack include 8 hours of runtime on a stiff hand, 3-hour recharge time. Nightly recharging is recommended to prevent battery discharge during optimal usage hours. The patient is not tethered to a wall outlet while using the device, translating into increased wear compliance. Morning warm-up of stiff soft tissue prior to ADLs and/or home exercise program. Decreased need or use of fluidotherapy paraffin bath modalities. These therapeutic resources may be chosen for other candidates due to the Hand CPM patient being prepped for treatment upon arrival, secondary to utilizing their device en route to therapy. Delivery of more skilled, higher reimbursing therapeutic intervention due to passive range of motion being addressed by the machine. Ability to deliver more aggressive therapy, joint mobilization, ASTM, knowing that the patient can manage potential inflammatory response during and upon return to home. Countless hours of prime at home in addition to sensory integration, desensitization for the patient combating CRPS. Just as delayed intervention is a mistake when addressing joint contractures, inadequate torque or range of motion settings when choosing Hand CPM as an intervention should be addressed and instructed upon during the initial fitting. Orthopedically speaking, on a subjective stretch scale of 0 out of 10, an in-range stretch of a 5 to 6 should be reported by the patient as the device reaches flexion and extension end ranges of motion. The exception to this rule is the diagnosis of CRPS. Range of motion is a secondary benefit as the primary intention of the machine is desensitization, a slow speed setting, large glove, low torque, and the subjective stretch scale goal of a 1 to 2 on a 0 out of 10 scale is appropriate with this sympathetic disorder. Once again, the anatomical structures of the hand and wrist are complex. Bony and soft tissue structures that work in unison exist in tight compartments. Therefore, timely intervention is critical to restore maximum function to the hand-wrist complex from a rehabilitation perspective. The stages of soft tissue recovery dictate that the appropriate modalities be chosen at the correct time. In the acute stages, Hand CPM is ideal because of the modality's influence on the overall inflammatory response. In general, Hand CPM is most effective in the first 90 days post-injury or surgery. When extra-articular soft tissue has shortened or contracted, low-load prolonged stretch devices are now warranted to influence creep-based loading or plastic deformation. When pain and edema are well controlled, transitioning to splinting is ideal due to the responsive characteristics of soft tissue remodeling. This stage extends up to 1 year. However, timely intervention is important to produce both positive results and cost containment while avoiding residual fibrotic changes. Thank you for watching this short Vector 2 Hand CPM video. Although numerous clinical scenarios have been discussed, it is impossible to encapsulate the decade worth of treatment techniques and considerations offered by a well-appreciated customer base. Therefore, it is encouraged for you to connect with your local 2N representative as additional resources are housed internally. In closing, my name is Perry Mervar. I am Vice President of Thuasne USA regarding the Vector 2 Hand CPM. My organization is excited to bring this technology to the upper extremity market. If you have additional questions or would like to be connected to a local 2N representative, I may be reached at pmervar@thuasneusa.com. My best to you and your patients.